the Lifecourse approach to non-communicable diseases prevention. So this lecture is to explain how we can prevent non-communicable diseases at different stages of life. Non-communicable disease can be prevented at different stages of life. So how can we do that? That means we're going to look at each stage, and then we'll consider what is possible, what can we do at each stage. But before we go on to each stage, I'd like to introduce the topic very well. Why is important? The importance. The prevention of non-communicable diseases has become an issue of their importance because its burden falls mainly on us. That is developing countries. For the developing countries, we're struggling with non-communicable diseases in addition to the communicable diseases that was a major problem before. So we know that in this part of the world, infection is a major problem. That's what is communicable disease. These infections that we are fighting, we have not conquered all of them. Now, non-communicable disease is being added to them. So we have a double burden of disease. So it makes the problem worse. Prevention of non-communicable diseases will improve morbidity and mortality generally, especially in these developing countries. And if we are able to reduce the risk of non-communicable diseases and prevent them, we'll have a lot of gain, enormous gain for the economic development of these developing countries. So what the World Health Organization is focusing on is how they can reduce the major risk factors. Can anybody remind us of the major risk factors for non-communicable diseases? The major risk factors. Anyone? The first one, avoidance of tobacco. Avoidance of alcohol.
Harmful use of alcohol.
Thank you. Then prevention of
exercise.
Okay. Exercise, that means avoiding sedentary lifestyle, being active.
Sedentary lifestyle.
Yes. And then the big one, the one we're concerned about, healthy diets. So these are the major four. So what the World Health Organization is working on is how we can reduce this. If you can reduce these four, if you can avoid tobacco, alcohol, physical inactivity, and unhealthy diets, then we will reduce non-communicable diseases tremendously. Healthy diet throughout the life cycle plays an important role, and that's what we're concerned about in this lecture. Another person will be teaching you tobacco, alcohol, but I'm focusing on healthy diets. If we can ensure healthy diets at every stage of life, then we can prevent a lot of non-communicable diseases. And it's good to know that there's additive negative impact of undernutrition in the life of a woman from birth through childhood, adolescence, to adulthood. So what that statement is saying is that if somebody is undernourished, even as a baby, the fact that the person is undernourished as a baby will affect that person in adolescence, in adults, and continuously like that, compared to his or her counterparts who were not affected in childhood. So if we prevent it in childhood, then we're already preventing it in adult. That's the message. We don't wait until someone is an adult before we are concerned about diabetes, hypertension, cancer, and other non-communicable diseases. This life course perspective has great potential. because diet, even at the preconception stage, impacts upon the body throughout the life stages. That's why if a lady is undernourished, even before she gets pregnant, the inadequate nutrients, inadequate nutrition in the body of that lady will affect the fetus when she eventually gets pregnant. This is how powerful nutrition is. And that shows how important prevention at every stage is. So even if you pick a girl of 17, 19, 20, and ensure that that girl is well nourished, you're preventing non-communicable disease in the adult life of the child that that girl will give birth to. If you get that statement, then you understand this lecture. That picking a girl at age 20, pre-conception, before the girl even dates anyone and gets married and gets pregnant, and we begin to ensure that that girl is well nourished, we're taking care of the adult life of the child that that girl will give birth to. The risk of many non-communicable diseases begin from fetal development through childhood and adolescence. Undernourished mother gives birth to infants with low birth weights. Maternal and fetal nutrition status is important at every stage for future generations, not just for their own health. And that brings us to the thrifty phenotype hypothesis, which states that reduced fetal growth is strongly associated with non-communicable diseases. I'm going to show you this cycle. And this is the thrifty phenotype hypothesis. So it might look complicated, but the major message I just want you to get from it is that maternal stress, look at the box up, the uppermost rectangular box. If a lady is stressed or has infection or is undernourished, whatever, has one problem or the other, or indulges in smoking or alcohol, so is undernourished, or is programmed for non-communicable diseases. The arrow goes to my right. In utero programming. So because of that inadequate state of the woman, the baby that the woman will conceive is already programmed for problems, programmed to be small. If there's inadequate nutrition in the mother, the baby is programmed to be small. There will be low birth weight. The baby will not grow well. Changes in growth, metabolism, vasculature. And this will affect several organs. There can be reduced pancreatic beta cell mass. Remember, the pancreas is where insulin is produced. So if there's reduced pancreatic beta cell mass, what disease can that child have in the future? Anybody? The child can
Diabetes.
thank you. The child can have problem with beta cell function, leading to insulin resistance and diabetes in later life. Muscle, liver, adipose tissue can also be affected. On and on like that. The kidney can be programmed to have problem in later life just because that baby in the womb is not well nourished. In fact, the Baker's theory states that the organ that is affected, this thrifty phenotype is related to Baker's theory. So that's how I'm combining them. The organ that is affected, as you can see in the diagram, the particular organ affected will determine the non-communicable disease that will be experienced in later life. So if the problem was with the kidney, maybe it's the time that the kidney is developing that the mother has nutrition insults. So the kidney of that baby is not well developed, that child is likely to have hypertension or renal disease in later life. And if some of these problems combine in such a way that there is obesity, especially abdominal obesity, hypertension, hyperglycemia or diabetes, hyperlipidemia, in one person, this person has metabolic syndrome. I hope you can see metabolic syndrome to my extreme left. That's a concept that you should understand and master. So in any situation where an individual has 3 of those 4 conditions I mentioned, that is referred to as metabolic syndrome. Okay, so having introduced the topic, how can we prevent non-communicable diseases at preconception and prenatal stages? I hope you know the difference. Preconception is before getting pregnant. Prenatal is pregnancy. What can we do? So we've explained the obesity epidemic and other non-communicable diseases may be as a result of poor in utero nutrition combined with subsequent exposure. Okay, I've not explained that aspect, but I've explained the first part. That non-communicable diseases in later life can be because of poor nutrition in childhood. But the other aspect is is to add that especially when there is subsequent exposure to obesogenic environment. So if a child is programmed to be small because of inadequate nutrition in childhood, and that child continues with small food like that, doesn't take junks, the child doesn't take excess fat, excess carbohydrates, the person may be able to escape these diseases. But if that person is exposed to poor obesogenic environments, environment that favor junks, that favor consumption of unhealthy diet, that favor inadequate physical activity, then the risk is higher. The risk of those non-communicable diseases will be higher. So concerted efforts are needed to prevent both undernutrition and overnutrition at these preconception and prenatal stages. So this healthy diet we've been talking about, what exactly does it mean? In a nutshell, it means adequate consumption of fruits and vegetables, whole grains, legumes, fish, adequate consumption of water, and avoidance of junks, excess sodium, excess fats, to obtain energy in just the recommended amount, and as well as other nutrients. If all of this is practiced, then we can say that person is eating healthy. So other details will include low consumption of sugar, fats. But if a mother takes junks at this preconception and prenatal stage, that mother programs the baby for junk. The baby will also like to eat junks, pastries, cake, meat pie, all those pastries, and then sugar-laden drinks that are high in sugar and other sweeteners. Reduction in the prevalence of maternal diabetes prevents hyperglycemia in utero. So it's very important that maternal diabetes is prevented. Another thing that is important at this stage is iron. Adequate iron must be taken. And that's why we don't depend on diet alone, because diet alone cannot fulfill the iron needs in pregnancy. Iron supplements are given to meet the need. If there is deficiency, then the child will have low intelligence, the child can be stunted, and this will in turn increase the risk of cardiovascular diseases in later life. Our baby is now an infant. What is important? Breastfeeding, breastfeeding. Exclusive breastfeeding is necessary in the first 6 months of life. Thereafter, adequate complementary feeds should be introduced. The risk of obesity is 22% lower among breastfed children compared to those who are not. And the reason is simple, because infant formula contains higher level of energy and protein. So if a baby is fed on infant formula, it's likely to be overweight and obese. Of course, some of them are undernourished, but if the baby is well fed and the risk of being overfed is there, so it can lead to obesity. But for babies who are breastfed, they self-regulate their feet and the risk of obesity is very low. When the child is 6 months, complementary feeding should be frequent and nutrient-rich. It should be diverse. The diet should be diverse. A baby should not be given pap and pap alone because she's a baby. Should be given wide variety of food. Both undernutrition and overnutrition are risk factors for NCDs in later life. So excess carbohydrate should be avoided, just like excess protein should be avoided. Excess protein, many people are not yet aware of this. They think it's not bad, baby will grow well. But now, through research, we know that even at this stage of infanthood, a baby should not be given excess protein. So the recommended dietary allowance is 1.2 grams per kg per day. If it's excess, there will be higher growth rates, obesity, and in turn, increase in non-communicable diseases. Childhood, what should we do in childhood? We should avoid extreme parental control during feeding. So let the baby feed himself. Let the baby control the food. Don't use food as a reward or punishment. Just make sure that a wide variety of food is available. And the child should not eat only cooked food, only adult food. Fruits and vegetables should be taken along. The child needs 3 servings of fruits and vegetables. Dietary pattern that is formed at this stage is very important, and that's why children should be encouraged to eat with adults. Adults should also serve as good role models. If parents don't eat vegetables, then it should be difficult to convince the children to eat vegetables. Structured routine for meals and snacks, family meals are encouraged. If a family eats together at least once a day, then there will be opportunity, or which word should I use now? If a family eats together at least once a day, then we'll be able to ensure that the child or the adolescent is also eating healthy meal at least once a day. In early childhood, these practices are desirable. Every child should learn to eat breakfast, limit consumption of pastries, avoid sugar-sweetened beverages, limit television viewing, encourage physical activities. Pre and probiotics are important, and they should be given in form of foods that have been, somebody should please give me the word. What we use? Fermented foods. Yes, fermented foods like pap or yogurt. It's very important. A child should be engaged in at least 60 minutes of physical activity structured around play. It shouldn't be like punishment. So the child should see it as play. In adolescence, healthy lifestyle is still very important. This period is developmental period between childhood and adulthood. Is a time of rapid growth. The growth at this stage is second only to the growth in infanthood. Adequate diet is important to supply adequate amount of calcium, 1,300 milligrams, to prevent osteoporosis in adult life. Foods that block calcium, such as caffeine, should be avoided. Excessive consumption of nutrients through unhealthy diets that will lead to obesity should be avoided. So the behavior that is established at this stage also matters. And 50% of non-communicable diseases associated with behaviors that begin or are reinforced during this period. So what do we encourage? What are the desirable practices? Avoid skipping meals. Adolescents like to skip meals and after that eat junks. So we need to help them. They should eat foods that are rich in iron and calcium. Limit intake of added sugar. Avoid consumption of alcohol. Intervention programs to reduce NCDs in adolescents are very important. Policies, legislations. Since they like technology, then we can just leverage on technology, social media to help them. In adulthood, this is when most of these non-communicable diseases show up. But it is not inevitable that they will have diseases or disabilities. So a lot can still be done to help adults who are about to develop non-communicable diseases. So lifestyle factors can modify this. So all the things we've discussed about risk factors for non-communicable diseases and how to prevent them, if they are established even at this adult stage, they can still help the adults a lot. So all adults should aim at healthy body weights, recommended levels of blood lipids, pressure, and glucose. They should engage in regular physical activities. Avoid use and exposure to tobacco products. Consume foods rich in vegetables and fruit, at least 5 portions of fruits and vegetables. Prepare food with less salt to avoid sodium. And one way to avoid sodium is to avoid highly processed foods. Limit intake of added sugar and moderate exercise, at least 30 minutes per day. In elderly, calcium is very important to prevent fracture, to make sure that the bone is healthy. Calcium supplementation can be given. Regular screening for breast, cervix, prostate to avoid cancer are important. Annual wellness checks. They should avoid skipping meals. Some elderly people will tell you, the breakfast I ate, I've not used it for anything, I've not moved around, why should I eat? So we need to note that they should avoid skipping meals. Drink adequate amount of water, avoid consumption of alcohol, and be active generally. So in conclusion, non-communicable diseases can be prevented. Efforts are needed at every stage of life to ensure consumption of balanced diets, to maintain a reasonable weight, reduce saturated fat, cholesterol intake, and then to be physically active. Nutrition is not complete without
physical activity.
Thank you. Thank you. So physical activity is what will balance nutrition, because the amount of food that adults take to provide enough nutrients will be too much in terms of the calorie. But the way to go around this is to avoid refined sugar that release a lot of calories and to be physically active. Children should be offered nutrient-dense foods, no rationing. As long as the food is healthy, they know when to stop. So children should be given adequate food that will supply all the nutrients needed. Everyone needs fiber, at least 30 grams of fiber daily. So if these guidelines are combined with physical activities and harmful use of alcohol is avoided, we can reduce the risk of NCDs. Thank you. You can check some of these references to convince you further. And do well to lay hold on these books so that you have more understanding, especially this one, A Diet and Weight Control Tips. You can check Unilag Library, or you can reach out to your class rep to help you source for them. this is how we can prevent non-communicable disease from childhood. This book, the thrust of this book is to prevent obesity and micronutrient deficiency in children. And I've explained to you how micronutrient deficiency, obesity in children can lead to problems in later life. For those who are concerned about African foods or how to manage funds, the thrust of this book is eating healthy without spending too much. So locally available foods are presented in nice ways to encourage people to eat right without breaking the bank. And then this is not related to today's topic directly, but stress is one of the factors that is a risk for non-communicable disease. So it's very important to prevent stress. Thank you very much. Does anybody have any questions?